My name is Ty. I'm back at home. It's a week and a couple days post-op. I got my surgery on the 4th of September. So I'm going to show you how I change my bandages. So you can see I've already taken my bandages off. I went for a shower and I actually take my bandages off in the shower because I find it's a lot easier to take bandages off in the shower. So yeah, it works that way too with my chest bandages. My dog in the back. So yeah, so I took them off in the shower. So what I'm going to do now is I'm going to disinfect the scissors. Let's see here. Just putting some alcohol on a piece of tissue and disinfecting them. Don't want your incisions to get infected at all, so take every precaution. That's what I think anyways. Let's see here. So I disinfected my scissors. And what I got, so hard to find this too. Found it at a Rexall. It's a petroleum gauze. This is made by Kendall. So what it is, it's essentially gauze with Vaseline in it, and it keeps it from sticking to your incision or my nipples in this case. So it's actually been working really good. It's there you go. It's really easy to take off. So, and it's not sticking at all. It's good. This is my 3rd time changing my bandages. So let's see here. The packages look like this, but I bought the whole box. It just says Kendall Vaseline Petroleum Gauze 3-inch by 36 inches. So I just cut a little piece off of it. Let's see here. I already have a package that's opened. So it's all sticky. So what I do is I cut a little square off of it. Let's see here. Alright. And then I fold it in half. Just stick that on. There we go. Cover the nipple. And then you're supposed to get like an antibiotic ointment. You can get Polysporin or Neosporin. I just got the Life brand. Yeah, so it's just a Life brand. Take a Q-tip here and put it on top of the gauze. Not too much, you just need a thin layer. then I picked up a bag of bandages. It's the bigger bandages, obviously, because you kind of need that to cover the whole nipple. So, yeah. Gonna cover this one a little bit more because it's being a little wonky today. Well, yeah, I'll cover it a little bit more. They're at a different stage in healing already, that's for sure. They're starting to scab a lot more, which is good. Let's see here. Just cut another little strip off. Well, we learned together, and I think one is good enough today. Alright. So, what I do is, like, I get kind of allergic to Band-Aids, and it kind of hurts taking it off. So I cut around the edges so that there's only a little piece of the part that sticks to my skin. So I'm just gonna cut the Band-Aid. Nipple care 101. Alright. Band-Aid. There we go. Nipple complete. Do the same with the other side. So, gonna grab a new piece of the gauze. Petroleum gauze. Honestly, don't put regular gauze on there. I tried, took it off. It really hurt. Even though I had saline water. So, that's why I looked everywhere for the petroleum gauze. So again, I'm just going to fold it into here, this little strip. And whoa, nipple's kind of bleeding there. That's okay. Yuck. Still very fragile. Let me tell you that. They really hurt. They're really sensitive. Alright, so I'm going to take that ointment again. Put just a bit on the nipple dressing. Just wipe up that blood. Yeah, my nipples really haven't stopped bleeding yet. Like, they have, but they bleed every now and then, and so do my incisions, so pretty sure that's normal. I love what I have like an appointment at the wound clinic in Hamilton tomorrow, but I was talking to the lady on the phone, and I was like, they look like burnt pepperoni. Is that normal? And she's like, well, with any skin graft, they look really angry. first month. So they do look angry. I thought that was a really good description of them. So let's take, again, the Band-Aids, the big ones. Gotta cover the whole nipple, and we'll cut it, just so there's not much sticking on my skin, because I feel like it's already irritating my skin. I have really sensitive skin. Let's see here. Yeah. Oh boy. Here we go. Beautiful. Okay. I'm just getting the computer plugged. Whoa. There we go. Oh, man. Alright, so now what I have to do is put some, so here's my nipple dressings. So what I have to do is put some ointment now on my drains. Pretty hard to see it here. My drain hole. There's like a little hole there. Oh, a little hole there. This is actually from my drain. It's like a bruise inside my skin, because the drains were moving around and irritating me and then kind of bruised my skin. So for trans guys, don't worry if you have bruising along the side, it's just from your drains. Let's see here. So, just gonna put a little bit of there we go. And this calls for a smaller Band-Aid, so you don't need a huge one. The holes are very small. Okay, just a normal size Band-Aid. Okay, let's see here. It's harder for me to get under there. There we go. Now for the last Band-Aid. Let's see here. Man. See how I'm bruised on the side around there? Okay. There we go. So I'll bandage it up. After shower routine. So now, for a month, to hold everything together, let's just pick up all the garbage. Whew, this is a lot of work. cap back in the box. Keep everything clean. So, then we're going to take 2 big pieces of gauze and we're going to put it over this, the whole incision, and then, gotta get my necklace, over there, and then this incision. Okay, this is where the tricky part comes in. And this is kind of where you need another person. So this is where I'm going to end my video because I'm going to get my girlfriend to help me put my tensor bandage around since I'm still not capable of doing it, since I can't move my arms to my back. So you're going to want to get someone to help you even a week after surgery. So, like, again, I'm just going to show you what I do. So I put it over all the incision, and then I put this one on as well on this side, and I wrap my tensor bandage around that. So I hoped you learned a little bit about aftercare after surgery, how to take care of your incisions, your nipples, your drain holes. Hope it was educational enough. Yeah, and like I said, this process lasts for a month, and the tensor bandage should also be worn for a month after surgery. So, thanks everyone for watching. Alright, peace.